I'm Kevin Davis, a family practice PA here at MCHC Clinic. I see middle-aged men every week. Most of them are tougher on their trucks than they are on their own bodies. So today, plain talk. 5 things most men ignore, the labs to ask for, the lifestyle fixes that actually work. If you're a man between 40 and 65, this is for you. If you're a wife, daughter, or a buddy trying to get one of these men to listen, this is for you too, so send it to him. Most men don't go to the doctor until something breaks, and that's not me throwing shade, that's just a stat. Middle-aged men in this country are less likely to have a regular provider, less likely to get screened for anything, and more likely to die 5 years before their wives. And a lot of times, that's fixable. Number 1, your heart. Heart disease is the leading cause of death in men in this country. It's not close. Most men who have had a heart attack didn't even know they were sick. Their cholesterol was normal. Their blood pressure had crept up by a few points for over a decade, but nobody flagged it. 3 things to know. 1, total cholesterol is not enough. Ask for a full lipid panel and ideally an ApoB. That's the single best blood test we have for cardiovascular risk factors. It measures the actual particles that drive plaque, not just the cholesterol cargo. 2, know your blood pressure. Not one rushed from from the hallway. Check it at home twice a week, in the morning, in the evening. Anything consistently over 130/80, flag it and talk to your provider. 3, if you're over 45 with any risk factors, a coronary calcium score. It's a low radiation CT that tells whether you have already plaque formation. It's cheap, it's available, and it changes treatment decisions in real time. Cardiologists love it. Most patients have never heard of it. Heart disease is the most preventable, most treatable thing on the list. Most men don't even know their actual numbers. Number 2, your head. This one matters and gets dismissed the most. Men die by suicide at 3 to 4 times the rate of women in this country. Among middle-aged men in Appalachia, those numbers are higher than the national average. We don't talk about it enough. Here's what depression looks like in middle-aged men, and it does not always look like sadness. It looks like exhaustion, the amount of time that sleep can't fix. It looks like irritability and a short fuse. It looks like a guy who's used to enjoy things like fishing, sports, his kids, his marriage, and now just goes through the motions. It's like drinking 3 times a week instead of just 1. It looks like I'm just fine. If any of that sounds like you or a man you love, talk to somebody, a doctor, your therapist, a pastor, a buddy. Medication can help, therapy can help, exercise can help, honest conversations can help. None of these make you weak. There is no version of being a strong man that includes suffering in silence until it kills you. Real strength is making the call. Number 3 is your sleep. Sleep apnea is the most underdiagnosed condition in middle-aged men. It's not just big guys who snore, but if you're carrying around extra weight, especially around the neck, your risk factor is much higher. The signs: you snore. Your wife says you stop breathing at night. You wake up unrefreshed no matter how long you slept. Morning headaches, drying in your mouth at nighttime, falling asleep at red lights or even at the desk in the afternoon. High blood pressure that won't budge on medicines. If that's any of you, ask for a home sleep study. It's easy, it's cheap. CPAP treatment changes life. I have patients who tell me they do not know what rested meant until they started using one. Untreated sleep apnea drives up blood pressure, heart attack risk, low testosterone, depression, weight gain. Fixing it fixes a stack of other problems. Number 4, your hormones, and specifically low testosterone. Symptoms of low T: fatigue, low libido, decreased motivation, harder time building muscle, more fat around the belly, mood changes, brain fog. A lot of men get these symptoms in their 40s and 50s and just assume it's aging. It's testable. Ask for total testosterone, free testosterone, sex hormone binding globulin, all drawn in the morning. But here's the part that most men aren't told. Before you reach for testosterone replacement therapy, testosterone is driven down by stuff you can actually fix. Bad sleep crushes testosterone. Fix sleep and apnea first. Extra weight, especially belly fat, converts testosterone to estrogen via an enzyme called aromatase. Losing 15 pounds often raises testosterone meaningfully. Alcohol, chronic drinking suppresses testosterone production. Chronic stress, cortisol up, testosterone down. Lack of strength training, the signal to make testosterone partly comes from using the muscles you have. Fix the basics first for 3 months, then run the labs. Then talk about TRT if you're still low. A lot of men can avoid TRT entirely with sleep, weight, strength training, and less alcohol. Number 5, your belly. Belly fat, the visceral fat, the stuff around your organs, is not cosmetic. It's an active organ that actually drives inflammation, insulin resistance, low testosterone, heart disease, fatty liver, and dementia risk. 2 ways to check. Your waist measurement around your belly button. Most men should be under 40 inches. Below 37 is better. Your fasting insulin. Most providers don't run. Anything over 10 starts to look like insulin resistance, even if your fasting glucose is still normal. Glucose is a lagging indicator. Insulin moves first. Both numbers are creeping. If both numbers are creeping up, you're in pre-diabetes territory, regardless of what your A1C says. The fix is not magic. It's protein at every meal, less processed foods, strength training twice a week, and walks after meals. The same boring stuff I tell everybody. It works. Here are the labs you need to get for your next visit. Total testosterone, free testosterone, sex hormone binding globulin, drawn in the morning, an ApoB, or comprehensive lipid profile, fasting insulin paired with the fasting glucose, A1C, which is a 3-month average of your blood sugar, vitamin D, TSH, and a free T4, basic thyroid test, a PSA starting at age 45 to 50 for most men. If you have a history of prostate cancer or you're African American, especially, you need to start at 45. Plus a blood sugar check, a waist measurement, and a real conversation about how you're sleeping and how you're feeling mentally. That's this real men's workup. Most men have never had one. Don't try to fix all things at one time. Run it in order. So this week, book an appointment first. Bring a list of these labs. Ask for them by name. This month, fix the basics. Sleep. If you snore, get a sleep study. 30 grams of protein at breakfast. 10-minute walk after meals. Strength training twice a week. Less alcohol. Next month, review your numbers. Whatever the labs show in the conversation, address those. Your heart, your mental health, your hormones, your sugar, you'll know where to focus on. The point is not to be the man who finds out he has a heart disease at a heart attack. 5 reasons to call this morning, and this is not something you need to get put off hold. If you have chest pain, chest pressure, especially with exertion, if you have shortness of breath, something that's new or worsening, a blood pressure that's consistently over 140/90, thoughts of harming yourself or feeling like you'd be better off dead, erectile dysfunction, something that's new or persistent. These are sometimes signs of first disease of heart disease. These aren't wait and see. These are, you need to take care of this week. Most men ignore this stuff until it breaks them. You don't have to. The labs are real. The lifestyle fixes work. The mental health conversation is loud. If this has helped, subscribe. I do this every week. Share it with the men that you love. And remember, I have a free newsletter that comes out every week, and the link will be in the description. For those of you above 45 or 50 and entering the second half of life, I also have another channel and a newsletter. Links will be in the comments as well. That is something that I know will benefit you. I'm Kevin Davis. Take care of yourself. Make the call. I'll see you next one.